For those living with bipolar disorder, the mind can feel like an emotional tempest of highs and lows. The energetic bursts of mania clash with the depleting fatigue and sadness of depression, like living in two different worlds. But what's really going on in the brain during these turbulent mood cycles, and how can it be treated? Welcome to Brain Explained. Let's take a deeper look. Bipolar disorder is a physical and emotional brain disorder characterized by mood swings between mania and depression. Now, while most people experience mood swings between mania and depression to a small extent, those with bipolar disorder often go days, weeks, or even months in one mood. And when this happens, daily lives and relationships are affected. There are certain signs and symptoms that point to bipolar disorder. But first, it's important to understand that the changing mood states don't always follow a set pattern. A person may also experience the same mood state several times, with periods of normalcy in between, before experiencing the opposite mood. Also, one mood can be sustained for a period of days, weeks, or months. For the manic phase specifically, symptoms ranges from excessive happiness, hopefulness, and excitement. Sudden and severe changes in mood, such as going from being joyful to being angry and hostile, restlessness, rapid speech and racing thoughts, increased energy and less need for sleep, increased impulsivity and poor judgment, such as suddenly quitting your job, to suicidal ideations and psychosis. The depressive episodes, on the other hand, manifest as overwhelming sadness, low energy and fatigue, lack of motivation, feelings of hopelessness or worthlessness, uncontrollable crying, irritability, insomnia or excessive sleep, a change in appetite causing weight loss or weight gain, thoughts of death or suicide, and so on. Interestingly, people suffering from bipolar disorders may also experience mixed episodes, which means having both manic and depressive symptoms together. When this happens, the negative feelings and thoughts that come with depression are present, but you also feel agitated, restless, and have high energy. People who experience mixed episodes often describe it as the worst part of bipolar disorder. Scientists don't yet know the exact cause of bipolar disorder, but they do believe there's a strong genetic component to it. In fact, bipolar disorder is considered one of the most heritable psychiatric conditions, with more than 2/3 of people with bipolar disorder having at least one close biological relative with the condition. Other factors that scientists say contribute to the development of bipolar disorder include changes in the brain and environmental factors like trauma and stress. It's been discovered that the brain of a person with bipolar disorder differs in many ways from the brain of a person without it. One contributing factor is an imbalance of certain chemicals in the brain called neurotransmitters. Scientists also believe that there are structural changes in the brains of people living with bipolar disorder, with certain regions of the brain experiencing a reduction in size. One of those regions is the gray matter. Present in both the brain and spinal cord, the gray matter plays an important role in enabling individuals to function properly each day. Reductions in gray matter can happen in areas of the brain associated with mood regulation, information processing, and awareness of bodily states. The hippocampus is another area of the brain affected in bipolar disorder. For the record, the hippocampus helps in emotional control, including stress response and memory formation and retrieval. And in some people with bipolar disorder, parts of the hippocampus are smaller than in people without a mood disorder. Testing for bipolar disorder is not as simple as taking a multiple-choice test or sending blood to a lab. While bipolar disorder does show distinct symptoms, there's no single test to confirm the condition. Often, doctors use a combination of methods to make a diagnosis. If you think you may have bipolar disorder, you can start by visiting a healthcare professional. They will perform a physical examination, discuss your medical history, and ask you some basic questions about your symptoms, family history, and life experiences. If your healthcare professional believes you may have bipolar disorder, then they will refer you to a psychiatrist who will do a more detailed mental health evaluation, where you will be asked a lot more questions that can feel intrusive but are only asked to make sure the psychiatrist or clinician can get enough information to make a proper diagnosis. Now, there are no specific blood tests or brain scans to diagnose bipolar disorder. And while a doctor may perform a physical exam and order lab tests, including a thyroid function test and urine analyses, these tests only help determine if other conditions or factors could be causing your symptoms to rule out bipolar. That's because certain thyroid issues like hypothyroidism can cause symptoms that are similar to those of bipolar disorder. Also, symptoms may be a side effect of medications, but overall, the diagnosis for bipolar disorder can take up to 3 weeks because it requires at least one depressive and one manic or hypomanic episode. An effective treatment plan for bipolar disorder usually includes a combination of psychotherapy and medications. Self-management strategies, like education and identifying the early symptoms of an episode or possible triggers of episodes, helpful lifestyle habits, such as exercise, yoga, and so on. Because bipolar disorder is a lifelong condition, its treatment is also a lifelong commitment. In fact, it can sometimes take several months to years before you and your healthcare provider find a comprehensive treatment plan that works best for you. And even though it can be discouraging, it's important to continue treatment to prevent a bad prognosis. If you enjoyed this video, give it a thumbs up. Don't forget to subscribe. Tune in next week to learn about bipolar 1, 2, and 3. Thanks for watching.